Hi, everyone. We're back with Medical Care Redefined podcast. Hi, Dr. Nguyen.
Hi, Lan.
So I think to start off, I wanted to kind of share a fun story. I think we talk about it here and there, and I don't even know if we mentioned it in previous podcasts, but recently I got to do more like community talks and panelists, and I always start off by sharing like why I get involved in the community, right? And it always starts off with Dr. Nguyen. Like, if you didn't know, about over 20 years ago, she was my Sunday school teacher. So I was 8 and you were like 18 or something, starting college. Yeah, and so I think from then, like, Dr. Nguyen has such like a fun personality, very like bright and bubbly, and I was like very drawn to it, and I really wanted to be more like you. I was like, oh, she has such big dreams, she wants to do big things. And so like, I don't even know if you know, like, I don't think I told you, but the reason why I teach Sunday school now is because I value that mentorship so much from you that I wanted to also kind of do the same thing, build that mentorship. And so anyways, recently in a talk I was talking about that, and then I mentioned that because I was the youth director for some time, I got to teach a lot of kids and get to know them on a personal level. And so they come out and they reached out to us for DPC internships all the time. They're like, hey, we need some hours to graduate. So we had an intern last spring that came and interned with us, invited me to his graduation, and now that we had a job opening, we actually hired him. So Steven works on our team now.
That is true.
So it was like a full circle just because it started like 20 years ago.
Yeah,
Isn't that cool?
It is pretty cool. Like, I really think like this is exciting for me, just because like this, even though DPC is a medical practice and we were always like pretty serious at work at time, but it's kind of like a family too. Like, Long is my nephew that comes here and work, and so we kind of all know each other, and then a lot of history. So it is a very fun environment, and it's cool to see that you guys grow up, and I'm still hanging around with you guys. So it's cool.
So I thought that was a cool story to tell, and kind of also shift back to like why, when you said like you wanted to open your own DPC practice, why I was so like into it, because I think one, I saw you chase your dreams and you followed yours, and it made me inspired to like follow mine. But also, like, I think you're so passionate about DPC. Like, the model that we have here is so affordable. So really today's episode is just talking about how affordable DPC healthcare is and why it's sustainable for patients. So kind of talking off about like what the difference between DPC versus insurance is. Like, what do you think stands out more than others, like based on that?
Yeah, so if you're like a small business, right, or like, or just a small business where you don't have a lot of employees, and it's like buying insurance for your employees is very expensive. And, even if, the employee is paying like $500 a month, the employee still has to pay a lot of that, and they still have a very high copay. And so, it's so expensive. I mean, like, for example, my family, I have myself and my husband and 2 kids, and a month, it costs us $1,400 a month.
Oh my gosh.
Yeah. And so if it was DPC, then it would have only cost us like $325 a month. And that's like to cover the whole family. So it actually saves a lot. In a year, I mean, if we were to do that, it would save like, each month I would save like $1,100 for just being able to use DPC.
Yeah.
So it's actually very, very affordable compared to insurance, because in insurance, you still have to pay a copay, and then you still have to pay a deductible. Like some of my patients who need an MRI, for example, I need to do an MRI of their brain or whatever. If I send them through insurance, they still have to pay their deductible, which then MRI will cost them like $1,000. Versus if I were to send them over there for a cash paying price, they charge $300.
That's true, yeah.
It's like $700 different, just because they still have to pay out of it because they haven't met the deductible. They went through the insurance. It cost them more than they were to pay cash.
Right.
It's just ridiculous.
I think one of the things in our brochure, even our pamphlet, it says that we're here to be the patient's advocate and team. And so we really try to help negotiate pricing in the best possible way. So even imaging, right? So MRIs, like we try to recommend. We call, like Dr. Nguyen has called around just trying to make sure whoever she sends to, like they're giving the patient the best pricing. Even x-rays, I think, are like the cost that we have our patients like $50.
Yeah, $50.
So very low cost. We try our best to negotiate, not just imaging either, but like
mammograms, yeah. So, and we're very picky about who we send to. So I actually really listen to my patients' feedback. So for example, this one place that they were doing MRIs, when I sent the patient over there, and then that provider was trying to get that patient to do all sorts of extra stuff that was going to cost her more money, and it was making her more anxious.
Yeah.
And then I was like, that's not the right way to do business over there. And so we actually called that provider and say, hey, this doesn't seem right. So that, and then going forward, I don't send refer over there, and we find different places, because for the truth is, we do really value our patient and making sure that they are getting the best of whatever the pricing or best care even. So it's not, we're busy, but we take the time to take care of our patient. And that's one of the things I'm very prideful about.
Hi, everyone. Thank you so much for tuning into our podcast episode. This is just a friendly reminder that our membership is as low as $85 a month for all your primary, urgent, and emergent care needs, as well as personalized services in weight loss and hormone replacement therapy.
Hi, my name is Christina. I am the nurse practitioner at DPC Health. I definitely like working here. I actually get to spend a good amount of time with patients, addressing their concerns, and then getting to know a little bit more about my patients as well.
Also labs, right? We negotiate with labs. I would call hey, if I'm going to send patient to you or labs to you, you better give me a good price, because I want to be able to give it affordable to our patient. So, sometimes labs, for example, hormone labs. We do a lot of hormone labs because of the way our clinic is. And some of my patients will come in, it's I have really good insurance, just bill my insurance, I think they'll be fine. And then the bill comes back, their bill is $1,500 for a lab that it would have only cost, so for testosterone, estrogen, the full panel usually do, it only costs us $86 for a patient, but they were to charge the insurance, and when insurance didn't cover it, the patient was responsible for $1,500.
Yeah, that is so crazy.
Yeah, and that's tenfold, more than tenfold. That's crazy. So anyway, we really try our best to do that so that we can save patients money.
Yeah, and I think to touch base on that too, ultrasounds, we negotiate ultrasounds, and we actually have an ultrasound tech that comes here, right? Lori is excellent. So I think we just message her, try to coordinate the time as she comes on site, takes up a room just to do ultrasounds. Even pharmaceutical needs, like medicine. Share a little bit more about that. You're always Dr. Nguyen's always negotiating pricing for patients, especially when it comes to medicine, calling all the pharmacies around, and even making sure that if she's sending something to Synergy, they're providing the best option for our patients too.
Yeah, I know. Synergy is our partnership, but patients is always somebody we really value, and we want them to use our pharmacy, or Synergy, but at the same time we want to make sure cost is effective.
Right.
So I always kind of ask, the other Dr. Nguyen, as in, hey, can you negotiate? And if you get to the other Dr. Nguyen, he does go, on the phone with different vendors all the time, hey, who can give me the better pricing?
Right.
And so we really do work really hard on that to control the pricing, so it's not out of the world expensive. And the other thing on that is I also really look at what generic medicine is out there. I think in a fee-for-service world, we allow a lot of drug rep to come to the office, right? And brand name medicine. It works so well, blah, blah, blah. But the thing is, the providers don't even know how much it costs the patient. So the provider just writes it. The doctor just writes it because a rep has brought lunch, so they feel guilty to write it. But then at the end of the day, even if a copay on a brand name medicine, they could still be paying $700 a month. But there is a generic available. Why are we not using that? Because I don't let that influence us. Because whenever a rep comes, it's what is my patient copay? What is their cash price? What is that? I ask all that.
Yeah.
So the truth is, a lot of the big rep, they don't really like me and they don't come here, which is fine. But because I use a lot of generic medicine so that we can save patients money. If there's no need to sometimes there's no generic, then we have to use the brand. But majority of the time, there's always an alternative.
That's true. And I think even when reps call and they're let's set up a lunch, I'm let's not waste each other's time. We don't need the free lunch just to have you come here and talk about things you're probably not even going to prescribe to the patient. So we're very transparent about that too. I think you touched base about insurance and how expensive that is per year. So I think I just kind of want to talk about the different options to pair DPC with for it to cover insurance, because we do experience a lot of that. So we talked about Zion Health before. I kind of want to just bring it up again. It's the best health sharing program out there for our patients, I think, because it covers preventative mammogram, colonoscopies. It even has dental, vision, and pharmacy benefits too if you need any of that. But for a family of, you guys have a family of four. You guys are paying what, $300?
$315.
Yes.
Yeah.
And so it fluctuates depending on your IUA. I think I'm a individual of one, and my IUA is a little bit lower because I wanted that. And so I'm paying about $100 on average for me. And so pairing that with the DPC membership, you're saving so much money compared to insurance. Now,
and that covers for like preventive stuff, right? So colonoscopy, mammogram, and then also if and then like you can just submit the receipt. So like if like vaccinations they cover,
That's true.
and so if hospitalization specialists, you just have to submit the receipt.
all of
So
that.
it's actually pretty good. So for us, like, I mean, like I said, I was paying, and then we have DPC already, but like we were paying $1,400 or $1,500 a month, and now mine is now done at $315. So it's like, what? I save $1,400 a month. I'm so excited. So yeah, that's something that I've switched over, and I'm really actually very happy about that.
Yes, I really do love Zion Health too. And so that's my preferred option for patients. But if a patient comes and they really want something just for ER visits, we can definitely pair them up with a supplemental ER plan. I think it's $89.99 a month for them and all of their dependents. They do have like a dental and vision add-on, but you really only get the ER benefits. So I think someone was asking me like, oh, what happens if my appendicitis, like I have appendicitis and my appendix bursts? Do I get that coverage in the ER? And technically no, because you got to go to the surgery room, the OR room. So that's not covered in the ER. So you got to be kind of understand that piece.
But if you have Zion, that is covered. So it's like they cover for pregnancies and all that stuff. So I kind of wish like I got Zion earlier. I would have saved a lot more money because I still had. So when I had insurance and I was pregnant, I actually still had a $8,000 deductible, and the AUA for the plan that we're on, and I was paying $1,500 a month and $8,000 deductible.
Yes.
With the AUA on the plan that we're on was higher. It was $5,000 deductible, but I was only paying $315 a month, like for the whole family.
Yeah.
So anyway.
Yeah. It is. It's more cost efficient. So yes, Zion Health, the ER plan, and then if you really, really want to, you can do a high deductible insurance plan. I hardly recommend that to patients just because you even have to wait like a waiting period. I think Philadelphia insurance or something is like a year waiting, so pre-existing conditions aren't covered and all of this stuff. But that is an option if a patient is really like, hey, this is something I'm used to. I like the insurance, and so we have different options to kind of pair just to make it make sense, but it's still affordable. So I think that's the key component here. DPC is still trying to make things affordable.
Before we listen to our next patient testimony, we just want to remind you that DPC Health is available for small businesses too. As a small business owner, you can contribute as much or as little as you want towards your membership for your employees. We also provide mobile services so we can come on site to your workplace whenever you need us to. Let us be your medical team and doctor at DPC Health, where medical care is redefined.
Hi, my name is Phương. I am a medical assistant here at DPC Health. I really like DPC Health because of the model that we work here. We membership-based clinic, there's no insurance, and here Dr. Nguyen and Christina, nurse practitioner, would be able to provide you a lot of patient care time. I really like how we be able to make a change in patient care. I love to see people coming back and, greet us and talk to us as we like a family to them.
So I kind of want to touch base too about how you as a doctor, you're avoiding the ER and urgent care business for patients. Like how are you able to do that by focusing on things like preventative care?
Right. So our big thing is like what I always talk to our patient is like, my goal for you is to optimize your health.
Right.
And I do all measures to do that. So that like, even though we're family medicine, we do primary care, so we see the kids and all the way adult, like, so your diabetes, your hypertension, all that we manage. But then we also look at your hormones, like how can you optimize that? And then we also look at your weight management. So we kind of look at everything in a big picture. Then we work on preventive stuff, right? If you're most doctors do not manage diabetes until the A1C is 6.5, like when they start being diabetic. I start talking to my patient when their insulin is resistant. A1C is like 5 point. So just to kind of recap, pre-diabetes is A1C which is average sugar over 3 months, from 5.7 to 6.4. That's pre-diabetes. I start to talk to my patient at pre-diabetes. I don't wait until like diabetes, because by the time you're diabetic, you have to take medicine, and then you're already resistant. It's going to be a lot harder to reverse. So I talk to them early, and so that's that. I look at their blood pressure all the time. If their blood pressure is starting high, like I talked about lifestyle changes, right? And then I look at their cholesterol, the numbers is high. Like I start to do things, or like a lot of people don't want to be on statin. Well, let's talk about like preventive stuff like fish oil, red yeast rice, stuff like that. So we'll talk about those things and start to implement it early to prevent them from having the full disease.
Yes.
So their chance of having a stroke or a heart attack is going to be less likely, is because we're taking care of the preventive stuff so early in the stage. And so that's kind of the way we approach things. That's preventive medicine. And that's something I'm so passionate about. And weight loss, right? A lot of patients is just poor eating habits or whatever it is that cause them, their stress, all that, cause them to gain weight. Well, the weight causes the diabetes, the hypertension, the cardiovascular disease. So we work on the weight, we fix all the other problems. So it's kind of like, as a physician that we are, the practice that we are, we look at everything as a whole. That allows us to really optimize our patients' health to prevent them from going to the ER. I mean, if they're in the ER, like for having a heart attack, there's a problem, right? We didn't do our job. So that's kind of like why I really love this model, is because we spend a lot of time with patients. Like, our physical takes an hour. Why is that? I mean, usually like in a fee-for-service, like, you listen to your heart, lungs, and then you leave. Well, with us, we're reviewing their labs, we're doing their body, we're educating, we're understanding what's going on with them. That's why it's taking in hours, because we really want to prevent them from having to go to the hospital and go to the ER, because we're spending a lot of time with them for the preventive visit. And that's really, really important.
Yeah, I like what I love everything you're saying, but I like what you said about optimal range. I think you talk about that a lot. And so a lot of patients come to you from, when I set up the first visit, they're like, my doctor, I don't feel good. My doctor keeps saying I'm in the right range, but I just don't believe it, And so I think you have a higher, urgency to get patients to this optimal level, because you know that they're going to feel better rather than being in this normal range, right? Yeah. So I think that's super key to how you practice the medicine, and I love that. And then same thing with the visits. Part of DPC being so affordable is the patient can come in as often as they need to, and you are spending that much time with the patient. And honestly, I don't think an hour is enough for you with a patient.
I know, and I'm still running late after hours.
So yes, you really love like the building that patient-doctor relationship, which I think makes DPC, so successful in what we do and the model that we do, because you're able to provide, the extra time and care and attention to patients. So DPC, all of your clinic visits are covered, so that makes it affordable. A lot of other things I want us to touch base on that isn't a cost to our patients, like flu and strep testing, right? And some injectables, and even some of the lab work, depending on what tier you're on. Why is that? Why do you not include that in a membership?
Yeah. So we have like our VIP membership, is because like I call that a VIP, but it's our tier 1. It includes everything. And so this is great for patients without insurance. Now, some patients, they do have insurance and they still want to use us. So that's why we created tier 2, so that we can have lab build the insurance for some of the labs, and like physical labs, usually lab will pay for it. And so that's the reason why we have that tier 2. But in tier 1, it just includes so much of it. So in somebody who has no insurance, it's a perfect membership, because it covers for their cholesterol, their diabetes, their hypertension, like their thyroid, their vitamin D, everything that I look at on optimization. So all that is included. And it includes, like, if they were sick, they need a steroid shot, like that's included. And if they play tennis and they hurt their elbow and they have tennis elbow, I can do a shot there if it's pretty bad, right? So there's so much that we can do that is involving. And even like IV antibiotics, right? So why do I have a patient here the other day. She usually, she was so sick that generally she'll need to go into the hospital to get IV antibiotics. Well, there's certain IV antibiotics that we can do here in the office where she doesn't have to go to the hospital. And so that's how we get them out of the hospital. We put in IV fluids and we put IV antibiotics in there, and she was feeling really sick, so we put some vitamins in the IV, which in a hospital setting or ER setting, they never put vitamins in an IV bag. So that is something we even do more than a hospital or an ER setting, right? And she walked out of here feeling great, which is actually, and she was miserable walking in. So I think that is, one of the things we're really prideful about, is because we do go beyond for our patient to prevent them from having to go in the hospital, especially if it is something that we can handle.
Yeah, and on top of that, we also try to avoid sending patients out for referrals and specialty things, right? And so I've seen Dr. Nguyen, she's like, okay, this is a tricky one, but I'm going to figure it out. And so she goes and she studies and she figures out for the patient. So tell us more, what's the limitation that you have, and why do you not refer to specialists?
Yeah. So, I think that the specialists are very valuable.
Yes.
Don't get me wrong, and we do refer, and I do call them a lot, but I try to do what I can because it's trying to save patients money, right? So like the other day, I got a patient come in with really bad ingrown toenail. In a fee-for-service, when you don't have time,
I didn't even know that.
They don't even do like ingrown toenail, like they just refer out to podiatry to do ingrown toenail. Well, it's something that I was trained in, and I'd done a lot of it in residency, right? And so I actually just took care of it so that he doesn't have to go to the ER, to a podiatrist, because sometimes you can't get in right away, and it may take them a few weeks to get in, and he's in pain. So, he came in, and we just did it, and he walked out of here pain-free. So it is something that we can do. Now, there are things that I can't do. I have to say, like somebody who has really bad, like for example, if they have a broken bone, right? If it's a broken bone that's aligned, the bone is not sticking out, then I can put a cast, a splint, and monitor that. But sometimes I can't. If it's broken and it's not displaced and it requires orthopedic physician to put it back in place or do an open surgery or something like that, I can't do that. So we have to refer that out. And then sometimes we have to do echocardiogram. So I predict, like for example, I do an EKG, I listen to their heart, and I find that there's like fluid in their lungs that I'm concerned that and then fluid in their legs, I'm concerned they may have a heart failure condition. Then I have to send them to a cardiologist to do an echocardiogram, meaning ultrasound of their heart, to further evaluate. That's something that we can't do. So there are certain things that is limited, but if the patient doesn't have insurance, we actually do call around to see who can provide the cheapest price, right? So an echocardiogram, for example, some places charges thousands of dollars, and some places like a few $100s. So we have done that for a patient. We pick up the phone and we call that. But yes, we try to refer out, and then I actually personally will call some of the cardiologists or the neurologists or the different doctors to kind of talk to them so that our patient is getting, we're on the same page.
Yeah, so I think what makes us, I feel like you unique as a doctor is you're going to do everything you possibly can. And of course, if you feel like it's out of your zone, then you're going to go refer. And I think that because we run a DPC model, we have that time to like do the extra things for the patients. So I would just kind of want to touch base on the financial advantages for patients without insurance and using us. In a DPC clinic, our patient panel is actually lower than what an insurance one is because, we want to make sure we're spending the time with the patients, and we add on providers as we need to. I remember I got a call just from a doctor of like one of our patients that was just interested in potentially opening a DPC, and she's like, my panel right now is 4,000 in the insurance world, and I was like, that's like an insane number for one doctor.
One provider,
yeah, because they're just they're going, and they have to bill to insurance and coding and all of that. And so with the lower patient panel, it allows more visit times, better outcomes, not as many referrals to specialists. Like we do the most that we can for our patients. And then also in the insurance world, like when in the admin side, because I guess I'm part of the admin side, they have to hire someone to bill and code and also think of that overhead cost to be able to cover all of the things that insurance requires to even do that, and like specific testing for employees and all of that.
Yeah, and so when we have that, the truth is, in a fee-for-service, I don't have enough supporting staff.
Yes.
So even though when I was working for a big system, I had a big panel. I have 5,000 patients under my panel.
Yeah.
But I only had one nurse. Here, I have, a smaller panel, but we have 4 or 5 nurses, and all of those are pertaining to patient care. Because even though, yes, there is like in a fee-for-service, there's a lot of people that work for that provider, that physician, but they're doing billing, they're doing like different things. They're not taking care of patients. They're all about making money. So in this case, we just take that portion out.
Yes.
Those employees are now focusing on patient care. So they're getting more, like even our staff, like you could like read our reviews, like, all the patients brave about our team. Like our nurses are so kind, they're always available. Why is that? It's because we have a lot of them. They're not overworked, they're taking care of our patients.
Yeah, and I think that I love that too. Like, even though I'm not always hands-on seeing the patient, if a patient calls, I'm like, what is your name? And then we just chat, we catch up. Like, I remember, like, certain patients has a mom that he's taking care of, or like a certain patient is, going on a trip. So like, I get to catch up with patients on that side too. So beyond like what we do for DPC, we do get to build that personal relationship with the patient. And I value that a lot as an employee here. And so I think just to kind of like bring it full circle with DPC, we have transparent pricing. So anything that is out of cost, in the
We tell them
membership.
ahead of time.
You do.
That's
And
correct.
so you let the patient know before you do anything. You're like, hey, are you comfortable or are you not? Like, let me know. Let me work with you on this. And then also we cut out the middleman of billing and coding. We also don't have any copays, premiums, deductibles, all that nonsense.
Yeah.
So DPC is like a flat cost and rate to our patients. And so just kind of give a recap to our model, our tier 2, which is what I usually recommend to patients to start just to get comfortable. It's $85 a month. It covers the 24/7 access, all their clinic visits, physicals that include the EKG, body comp, pap smear, breast exams, all the urgent care stuff Dr. Nguyen can do. So casting, splinting, laceration repair, joint injections, and now all of our specialty services, which is weight loss, hormones, and peptide.
Are all included. Yep, all included.
$85 a month. So yeah, we continue to practice this and we continue to do what we care about. And I think that's what makes DPC so fun. So I think just to bring it, just to close it out, what is, I guess, your favorite thing about being a DPC doctor versus what it was like in the insurance world for you?
I think getting to know my patient.
Yeah.
I think that like in a 5,000 panel, sometimes I cannot remember what that patient looks like. And we don't I don't remember because there's so many of them. But now, like, I know my patient. I know their story. Like you were just mentioning, like, oh, they said they were going to Europe. I was like, oh, how was your Europe trip? And like, and they know my kids. I know like their kids. It's just kind of cool to be able to have relationship with my patients. Like they're my friends, and they know, like, it's really cool that I'm not able to do that in a fee-for-service. Just like in and out was how my fee-for-service world was. And now, like, I have relationship, and it makes me enjoy seeing, even though if they come in for a lab, it's like, hey, I know who they are. Like, I know, I was like, how's your kids? Like things like that. So I think that being in this world allows me to really be the doctor that I want to be. Doing like the doctor that how we like want vision and being a physician, not so much of like crazy of like documentations and like I have to check boxes or else we won't be paid by insurance. And so my time of having to do that now, I'm focusing on taking care of patients, and it really allows me to be a better doctor.
Oh, I love that. Yes. And I think that if anyone like who's listening or tuning in, like if you're interested, typically there is like a $99 consultation I recommend just to get you in the door, just to kind of see the place. It's non-committal. You sit with Dr. Nguyen for all the consults, you get to know her and just see if it's a good fit for you. And then, if you're really unsure, then, that's kind of like the best way that I kind of bring it on, especially because membership is like a hard thing to say. But
people don't want to be committed. Understand. Yeah. So I think the consult is good. It's like $99, and like it depends. It includes his body composition, and then it also includes like the hormone stuff too. So like if they're doing hormones, it includes some of the lab work. So it's actually pretty reasonable pricing. Yeah.
Yes.
And I actually spend almost an hour with them.
There you go. Yes. So come by, get a consult with Dr. Nguyen because she would love to see you. So yeah, I think that kind of wraps up what I wanted to say about DPC being affordable and accessible. And also, I love what we do too. Even when I go out to network on my side of things, like I'm not obviously doing the doctoring things, I get to see patients that are networking with me, and they're always like our biggest advocate, and I love that. They're always like, oh, I use DPC, Dr. Nguyen's my favorite. And so it's so easy for me to step in a room and just talk about DPC too, just because we have like a team of advocates out there for us. So anyways, thank you everyone for listening in. We appreciate your time.
Yeah, thank you everyone.
This is DPC Health, for medical care is redefined.